Good morning, ladies and gentlemen. My name is Ryan Suter. I'm one of the senior investment managers here at Sharewise, and we're here this morning with Mathew Cherian. Now, Mathew is the Managing Director of Global Health. Now, he's been kind enough this morning to lend us his time and expertise regarding global health. Mathew, mate, thank you very much for your time. I'll let you take away with the presentation, and then, of course, as always, we'll open it up to Q&A afterwards.
Sure. Thank you, Ryan. Thank you for the introduction and the opportunity to present. While everyone's digesting the disclaimer, I might tell you a little bit about myself. I completed a business degree, double majoring in information tech and information management back in a long time ago, 1982, from Curtin University in Perth. And I've been managing software development for something like 4 decades, which in our space is a hell of a long time, probably 10 generations of significant innovation. In 1985, I set up a business called Working Systems, which was, aside from consulting services, it also developed software for any number of industries. So nothing specific, but for, yes, as you'd expect in Perth, mining companies, travel companies, hospitality solutions, financial solutions, and hospitals in 1992. A bit of history now. In the early 2000s, Working Systems was awarded a contract to develop a mental health clinical management system for deployment across the Australian Capital Territory. The software was deployed across the territory in public hospitals, private hospitals, call centers, rooms for psychiatrists, psychologists, GPs, social workers, and everyone else that was involved in helping people who were living with mental health issues. Now, this was a bit of an epiphany for us, and for me in particular. It highlighted the silos of information that did not get shared across a team that needed to share data in order to help me with my condition. And it also highlighted that clients, sorry, I should move on to the next slide. It also highlighted that clients were a key part of the treatment plan if you were living with a lifelong condition or a chronic disease. So the company decided to focus exclusively on the healthcare sector and platforms for the healthcare sector. And in 2008, we changed our name to Global Health to reflect this focus. So for providers, for the healthcare providers, we had a clinical system which we brand as Mastercare, which provides all the clinical functionality you need. And it's also team-based. So you have a team of different specialists sharing a clinical record or being able to see what they need to see. For providers, we also had a secure messaging platform, which allowed the sharing of data because not all the people were using the same software. And for consumers, we had a personal health record, which empowers patients to make and monitor the behavior changes they needed to do as part of their treatment plan. And finally, we had a digital engagement platform, which we call Hot Health, which allows consumers and their team of carers to communicate better and to engage better. Oops, sorry, back. Yeah. So today, our mission remains to enhance health outcomes for individuals and improve operational and financial outcomes for healthcare providers with a patient-centric and connected ecosystem. In essence, Global Health develop and market a portfolio of composable software and SaaS platforms that are designed to digitally connect consumers with their clinicians, encouraging a more collaborative healthcare model that automates workflow and delivers improved productivity and profitability for the operators, and empowers consumers to better manage their health. I want to move now to the bigger picture. There are many challenges faced by healthcare. I'd like to cover the two challenges that drives our strategy. The first key challenge is the unsustainable and escalating cost of healthcare globally. You've got better technology, so you get earlier detection of diseases, you get better prosthetics, devices. Pharmaceutical companies are generating new drugs all the time. So all this is adding to the cost of healthcare. These numbers here do not reflect the 200+ billion spent on the NDIS or the 7,000 that each of us spend as individuals on broadly healthcare related expenditure like healthy foods, gym memberships, vitamin supplements, and the like. So in our view, healthcare is actually the largest industry in Australia and probably globally. It affects everyone in the world. The second key challenge that drives our strategy is the increasing incidence of chronic disease. Sadly, mental health dominates the top 5 chronic diseases that we face as a nation. Mental health is rarely addressed by medications. It often involves a team of different skills, whether it's a psychiatrist, psychologist, social worker, employment consultant, or if you have diabetes and an endocrinologist, a nutritionist, a dietitian. They're all working with me, the patient, helping me change my behavior so that, whatever it is, I eat better, I exercise more, or I make, better friends, or be more sociable, whatever it needs to, whatever behavior change I need in order to address my mental health issue. What's the competitive advantage for global health? Well, quite simply put, because mental health, we have the full journey from early diagnosis through to treatment, and then through to rehab, and through to healthcare in the home. We deploy our solutions across a very broad segment of healthcare. A lot of our competitors are unique to a particular segment. So we might have one set of competitors when we're selling to a hospital, might have a different set of competitors when we're selling to private practice. But there's no competitor when it comes to chronic disease. We believe we are the only company in Australia that has the full patient journey, from early diagnosis through to treatment, through to a patient-empowered tool. Consequently, our clients cover everything. We've got the hospitals like Bethesda, East Sydney Private. You've got governments like the WA Mental Health Commission. You've got community health centres, and you've got large chains like Mercy and St John of God. The largest segment for us is super clinics or multi-sector, multi-specialist facilities. And at the smaller end, we have, typically smaller practices, private practices, solo GPs, or a group of 3 specialists or 5 allied health. And this diversity of delivery settings gives us a huge advantage, in my view. Let me turn to our financial performance briefly, and in particular, our expenses and EBITDA. As 2022 was the first year out of COVID, and like every other business, we experienced labor shortages, escalating healthcare costs, labor costs, and general inflation. Over the 24 months since, we've turned it around quite substantially. If you exclude our investments in the future growth of R&D, we've turned it around from a loss of 1.2 million in 22 to an EBITDA of 1.6 million in 2024. Now, the reason I've distinguished between EBITDA before R&D and EBITDA after R&D will be apparent in the next slide. As you can see, in 2022, we spent about just over 300 grand on R&D. We then escalated our investment in tomorrow's growth, which is basically non-earning development, non-revenue earning development. 1.7 million in 2023 and 2.7 million, roughly about close to 5 million was spent in the last 2 years alone. And the reason we accelerated this was to transition our mature applications, if I can call it that, because don't forget our electronic medical record, our hospital systems, and our GP systems were all written circa 20 years ago. So we needed to fast track the migration of our platforms to current technology and enable a focus on the next trend, which is obviously AI and so on. So if you consider that we spent 2.7 million and our EBITDA before R&D was 1.6, the R&D gives us the flexibility to either deliver a positive result or to invest in the future. Those expenses, by the way, includes all expenses, cost to serve, as well as overhead, sales, marketing, general admin, and R&D, if you add the two up. So we're pleasingly, our expenses outside of R&D, we reduced from 7.8-ish million in 2022 to about 7.1 in the last financial year. All right, moving along. I'll just look at our revenue now. Despite the redirection of a fair bit of our expenses to R&D, pleasingly, we were able to grow our revenue over the 24 months by some 25%, and pleasingly, our annual recurring revenue was up by 17%. Cost of goods sold went up a fair bit, but despite that, our margins improved, steadily climbing from 43% to 56% in the year just finished, which represents 30% growth in margins and a 64% increase in net revenue. I should point out that we do, in fact, expense all our R&D. So moving on to the market, the healthcare market size, we're fortunate because people living with chronic disease have their encounters in multiple settings, including the home. We have access to a large segment of the market. We do sell to hospitals, we do sell to specialists, we do sell to community health centers, about 500 of them in Australia, as well as the primary care sector, which is GPs and allied health. But most importantly, we also have, as part of our vision, the ability to market to healthcare consumers. It gives us the opportunity to land and expand as well. So, while a clinic or a hospital might be using Mastercare Plus, eventually we'll be in a position to say, well, you need some secure messaging to be able to send your discharge summaries or get referrals in from your referral base, and a digital front door to allow your patients to fill in pre-admission forms, to book appointments online, or to conduct video conferencing and discussion groups and chats and forums and the like. Moving along now to a bit of the forward plans. We believe we've broken the back of the accelerated R&D. So this financial year, we have started rolling out our new SaaS platforms as an upgrade to existing customers across our 3 platforms. We're also acquiring new local customers, that means new names, using digital channels, customer success officers, and BDMs. That'll kick off more aggressively in January. And we're doing a lot of upselling campaigns to upsell our digital front door and our secure messaging to existing clients as well. We're initiating the incorporation of AI into our SaaS platforms, and hopefully by June next year, we will have, right now we're analyzing the quantitative benefits for our customers and for ourselves before deciding which part of the AI paradigm we implement first. Following that, in the future state, after June next year, we will be looking to leverage our B2B market presence to sort of access the customers of our customers and transition into a B2C business as well, or add a B2C business to our business, as well as adding AI for our existing customers. Now, the other thing is that healthcare is a universal product. It affects everyone, whether if you've got diabetes or depression, the treatment plan is the same, whether you're in Toorak or in Timbuktu. So it is potentially a huge global market. So one of our focuses, which we've started doing now, is developing a solid relationship with our data center hosts, which is basically AWS and Microsoft Azure, to leverage their reseller network globally. The problems of healthcare are universal: escalating costs, incidence of chronic disease. Sorry. So some little housekeeping information. As you can see, some key observations is we have a very loyal and tightly held share register, with the top 20 controlling some 80%, and they've been with us for a while. I'm the largest shareholder. And if you look at our numbers, our enterprise value is less than 1 year's revenue. Finally, just introducing our board. We're all fairly passionate about transforming healthcare through technology. Grant Smith's been involved in hospital deployments and the hospital business for 40 years. He was the first corporatization of hospitals was under his oversight. Stephen started a very successful aged care software company that serviced the aged care sector, and which he sold to private equity, and is now on our board. Karen's ex-KPMG consultant who has done a lot of work with the public sector, particularly in Victoria Health. And Stephen is our corporate, been with Global Health for a while, so he knows healthcare, and he's provides the governance discipline that we need as a listed company. So thank you for listening. Please reach out after the questions if you have more questions my contact details are below. And over to you, Ryan.
Thank you.
Was I all right with time? I don't know.
No, we got plenty of time. I really appreciate the presentation. We'll just jump straight into the questions. Now, obviously, ladies and gentlemen, if you have any questions you'd like me to ask Mathew, please submit them using the Q&A function on Zoom. I'll just kick us off with a couple. Now, given the reported financial pressures on both public and private hospitals, how do you expect this to impact the financial results of Global Health?
Yeah, that's a good question. It's been in the press. Private hospitals are struggling. They've had no business through COVID lockdown, and they're not even being adequately financed by private insurance. We are fortunate in that we serve a wide community of healthcare providers, so we were able to pivot. Probably 4 or 5 of our hospitals actually had to close their doors, but we were able to pivot. And because of the breadth of our portfolio, start engaging for secure messaging and for community health. That's an advantage we have. If we were locked into hospitals, we would definitely have felt the adverse impacts of the challenges of hospitals.
Okay, well, thank you for that clarification. Now, obviously, given the breadth of your portfolio of products, what's Global Health's view on the potential impact AI is going to have on your SaaS applications and obviously future cybersecurity issues?
We're very excited about the impact AI is going to have in healthcare. I mean, healthcare is all about pattern recognition for once, radiology, pathology, and diagnosis. So we are actually working with a couple of AI providers, and internally we're doing a business case to work out the best bang for the buck, if you like, which will give our customers the best value, as well as us. And we understand that AI is going to be crucial to be able to analyze data and to be able to assist clinicians in making better decisions, definitely assist consumers. Because we've got Lifecard and Mastercare, AI is going to play a hugely important role in our future, which is why we accelerated our technology to the current SaaS. Since it's going to keep our customers safe for 20 years, another 20 years, now that they've got the new applications that we've invested in.
All right, well, thank you for that one. Now, given that obviously you guys have, drastically increased your R&D expenditure over the past 2 years, is your software and SaaS platforms, are they developed in-house or are they outsourced with that cost?
All our software has been designed, architected, and QA'd in-house. We own it all. But we do use contractors from time to time, whether they're overseas or local, for cutting code, and possibly doing some QA, doing some testing and that type of stuff. So it's a combination of both, but the core talent is Australia-based. And I might point out, by the way, that our R&D spend is going to start diminishing because we've broken the back of it. So we're not going to be 27% of expenses. 2.7 is probably going to be closer to 1.8 million over the next year or two, which will allow us to spend more on market development, if you like.
Okay, got you. Because we've got one of the participants submitted questions related to R&D expenditure moving forward. So obviously you expect that to diminish. Is that going to just continue for the next 1 or 2 years and then completely drop off, or is there going to be an ongoing expense that's going to kind of constantly exist on the balance?
So if you look at the 2.7 that we spent last year, that's going to be cut. That's down to probably 2 million this year and probably down to 1.8 next year. And a lot of that, but you have, as a tech company, you got to continually invest in R&D. But that investment will be more in AI and emerging trends rather than the fundamental shift in, from client server to SaaS, if you like.
Of course. Now, when it comes to marketing the platforms, especially the customer-facing ones like Lifecard, how exactly do you do this? Is it kind of reliant on healthcare providers you have partnerships with, or do you have a sales team that you work with?
It's interesting. When we initially did the business case or the planning for Lifecard, there were so many use cases. Young mothers, or new mothers, school, who need, if you've got kids, you've got to sign, disclaimers 5 times a year every time they go for an excursion or a trip or play sport. But our focus, because we're in the area of people living with lifelong or lifestyle conditions, we have a lot of lifeguard registrations, but we haven't monetized it yet.
Gotcha.
That's going to be post 25. And we think the market segments are huge. It's just, sometimes you got to decide where you get the best bang for the buck, and we feel the best bang for the buck was in what we did, investments in R&D right now. Yep. And lifeguard will be next year's focus.
Okay. Now, when it comes to actually charging providers and consumers for the use of your other platforms, what's the structure of that revenue?
So it's all subscription based, and we try and price our products so they are exceptional value. We believe we've done the market research, and we represent the best value in Australia today in all the segments we play in. And we try and tier them so that it's affordable to the small practice, a solo allied health practitioner or a part-time GP, the base subscription, and then there is a usage-based charge. So, if you're a large hospital, you're a large community health center doing lots of prescriptions, a lot of referrals, the subscriptions go up. There's the base subscription, and then there's the usage fee. And the bigger the subscription fee, the lower the usage fee, right? Because you commit, So it's the traditional SaaS model.
Okay. All right. Well, thank you for that clarification. Now, probably last one from me here today. Obviously, given GLH appears to be pretty tightly held on the market and it's coming off macro highs for pricing, why should investors be interested or potentially invest in GLH today?
Well, I think we represent exceptional value. Our enterprise value is less than 1 year's revenue. As we continue the trend of improving our performance, there's a much better opportunity to go from 14 cents to 54 cents for a company like us 3 or 4 times than it is if you invested in BHP or one of these large companies. Because I think we are at almost the lowest point of our valuation. So the only way is up, and all our KPIs are indicating that this will happen. So it's a compelling case, I think. The valuation is the key driver for it, and the fact that we're a public company, we don't raise capital for the sake of raising capital. We expense all our R&D, so we're fairly transparent as well. So
yes,
it's worth a look.
All right, thank you for that clarification, Dan. Now, one more from me, and I've got one more here. Now, with obviously the Australian healthcare market being a fairly large one, what percentage of the pre-existing market area currently can your consumers?
What percentage? Say that again. Sorry.
So what percentage of the Australian healthcare market are your consumers?
Well, if you look at the stats, chronic disease is 60% of the population. We're pretty confident that we are the market leaders in providing systems for providers of mental health services. We estimate that we have about 5 million consumers through our 500-600 customers that we have. So I'd suggest 5 to 6 million consumers is within our reach.
Thank you. Now, we've just got a couple of submitted questions here. Do you have any plans for expansion into New Zealand or the Asia Pacific telehealth markets?
Yes, we do. Generally, I'm fairly passionate. I was born and brought up in Singapore, and I know that there's a huge underserviced market north of in our neighborhood. 650 million consumers in the same time zone as us, from if you like, Thailand or East Malaysia through to Hong Kong, right? Vietnam, Thailand, Indonesia. And we have, as a country, a hugely migrant population that can service our neighborhood. So if you like, my initial instinct is to expand into our neighborhood because of the huge consumer market that's available, rather than the developed economies like Singapore or North America or Western Europe. So it's more the underserviced economies, which have the same problems, sedentary lifestyle, chronic disease, escalating healthcare costs.
Thank you for that one. Now, there's just a follow-up question based on that one. With the potential planned expansion, is there an associated timeline?
We are currently talking to a number of potential resellers. I think we announced last year that we've got a APAC reseller agreement with Fujitsu. And we also on the Microsoft Marketplace. So that involved a fair bit of exercise so that we are accessible globally through the Microsoft Marketplace. And the intention is we're doing the same with Amazon, by the way, because half our platforms are hosted on Amazon and the other half, two of them are hosted on Azure and two of them are hosted on Amazon.
Yeah.
So we're now talking to Amazon to get into their marketplace, and through those marketplaces, leverage their resellers globally. So rather than set up offices where in overseas countries, we definitely focus towards a channel reseller strategy.
Gotcha. Okay. Now, one I've got here is, when was the last time you increased the prices? And when you did so, was there much pushback?
Yeah, so around 20 in the since January this year, we have had to increase our prices. Normally we look at what the market's offering, and because of the increase in labor cost and shortage of labor, if you like, we've had to increase our prices. We did that probably about January this year. And there hasn't been much pushback. I think if you explain it to people and you explain to them that there's a lot of work we're being asked to do by the federal government and the Digital Health Agency, unfunded. So we've had to transition to, Telstra's prescription dispensing service, which is the monopoly. And we have to do all kinds of reports and changes that the software is meant to do. And so the clients understand that, actually, as long as you explain to them, and we're still good value.
Okay, good. All right, well, thank you for that one. Now, one last one I've got for us today is Global Health had an announcement a while back regarding a partnership with Woolworths. How is that progressing?
That unfortunately was a proof of concept, and Woolies actually pivoted their strategy. I think they owned a pharmacy, so they didn't need the prescriptions coming in. They changed their strategy, and so that's no longer they're no longer a customer of ours.
Gotcha. Okay. All right. Well, that about wraps everything up. Well, thank you very much for your time and expertise this morning, Mathew. Is there anything you'd like to leave us with?
Well, I want to thank everyone for giving us the time and their interest in global health. And like I said, if you need more information, please feel free to reach out. I think we're exceptional value. And I haven't been doing investor relations for 2 years. We focused on getting the business right. And now we think we're there. And so a lot of our focus will now shift towards getting value for our shareholders, which will enable us to do some growth through acquisitions. Right now, our growth has to be organic because at our valuation, it's very hard to execute on acquisitions. So we do want to work on getting a fair value for our shareholders, which will then present us with opportunities to grow inorganically as well through acquisitions.
Brilliant. Well, thank you very much for your time again, Mathew. Really appreciate it. And ladies and gentlemen, thank you very much for your time. Enjoy the rest of your day. Cheers.
Cheers.